government has welcomed Cuban doctors to join in its fight against COVID-19. The provincial health MEC, Nomafrench Mbombo, told the doctors that they were coming to work in a province with the highest rate of infections in South Africa. Mbombo says that they will now plan where the doctors are to be sent in the province. For the latest on the story, let's go live now to our reporter, Yazid Kamildin. Yazid, good afternoon to you and thanks for joining us. I mean, we know that the Western Cape is currently the epicenter of the outbreak in South Africa. Do we know what type of role the Cuban doctors will be playing in the Western Cape?
Good afternoon. I'm standing inside the provincial government headquarters in Cape Town, and I will be asking those questions to the MEC for Health here, Nomafrench Mbombo. In fact, I've got her right now next to me, and let's ask her those questions. We'll also be speaking to the head of mission from the Cuban delegation. Good afternoon and welcome to Newzroom Afrika.
Oh, thank you. Welcome as well in my building.
It's great to be in your building. So the first obvious question we need to ask you is, why did the Western Cape government get Cuban medical professionals to come and assist in its fight against the coronavirus pandemic?
It's an international initiative. Each and every province received the allocations for Western Cape. We received 28. And out of those, we have got the various categories of the family physicians, the epidemiologists, the biostatisticians, health technologies, in order to fight the epidemic.
Now, we do know that the Western Cape has the highest number of infections and also the highest number of deaths so far. What is the Western Cape Health Department doing to strengthen its fight against the pandemic?
Now we went to coming up with a plan for hotspots. Hotspots is the residential areas where people reside and they've got high level of local transmission. And most of them are as a result of the big clusters from the supermarkets, from the industry and all of those. So now we are zooming specific, for example, let's say Khayelitsha, where we divide it into many clusters, into pieces, so that we can have various interventions, not only for the health response, the economy side, the social development, the humanitarian side, and also we must make it a point that we prioritize the vulnerable community in terms of the testing and the quarantine and isolation. Those who are over that 55 years old, they've got a high risk of having a negative impact when it comes to the spread of the virus. Those who have got existing conditions, medical conditions, comorbidities, we have got more than one illnesses, the OMAs and the OPAs, the older persons, we have to ensure that at least we protect those people so that they don't get infected, especially from the young ones. For example, when the school is about to open now, although the children might not necessarily infected or get infected as compared to the adults, but the issue of when now they ended up, the children maybe coming back to the older persons and then they get infected. Same as for those older persons who are in the old age home, we have to protect them. So we see the role of the Cubans, because as I indicated, majority of them, they are family physicians, where they are needed in the community health space, in our district hospitals, in our primary healthcare clinics, because that is their strength. So we need all of those. Taking note that we do have other volunteers locally from the various categories, medical specialists, nurses and all of those. And we anticipate that for the CTICC, which is an additional field hospital, and others, we will need as more. There will be such an announcement for people actually when we have to appoint as many, including the GPs that probably don't have much to do right now.
Now, there are concerns that the hospitals of the Western Cape might not be prepared for the peak of the pandemic. We've heard that Groote Schuur Hospital, Tygerberg Hospital, Khayelitsha and Mitchells Plain Hospital all have staff that actually have tested positive for the coronavirus. What is happening on that front?
The health workers, it's also part of the clusters. And therefore, it's not necessarily a surprise when you get infected. Just we've seen that even South African police services, almost all the stations, police stations, they also affected correctional services everywhere. But in terms of the modeling, the projections, it did show us that we will have about even more than 40,000 of the people will be infected. Hence, our hospital bed plan was responding to such. So we already know that we have, with the 1,500 beds that we have for general hospitalization, we'll need extra 650-something, which is already the reason that we said we postpone some of the elective surgeries that are not emergencies, and also creating additional wards. That one will be better. But the issue you are talking about is the ICU beds, which is all over the world. There will always be a challenge when it comes to the ICU, not only about the beds, but also it comes with the ICU trained staff, be it a nurse or doctor or technical staff. Hence, we have purchased additional beds from the private hospitals for such.
Well, we do thank the Western Cape MEC for Health, and we'll be back soon with the head of mission from the Cuban medical delegation here in Cape Town.